This is an ultrasound evaluation of bilateral legs to rule out deep venous thrombosis. This is a dual image. On the left, we see an uncompressed common femoral vein medially, common femoral artery laterally. This is a transverse view. Right will be over here, left is over here. In the compression view, we see a slightly elongated artery indicating good compression and no common femoral vein indicating full compression of the vein. This is an image of the common femoral junction on the right side, common femoral artery, common femoral vein, proximal great saphenous vein. After compression, both the common femoral vein and great saphenous vein are not visualized, indicating complete compression of these vessels. The right femoral vein and profundal femoral vein can be seen on the left portion of this dual image. Here are the veins, artery, artery. The veins are going to be sandwiched in between the arteries. After compression, the two arteries are visualized. The veins are not, indicating complete compressibility of these veins. This is a proximal femoral vein. We call it the femoral vein. It's labeled as superficial femoral vein. This is the femoral artery, the femoral vein below it, and after compression, the femoral vein is gone. We're seeing the deep femoral artery in this image because of strong compression. This is the femoral vein in a mid portion. We see the vein here. This is the artery. After compression, the femoral artery in a mid portion is seen. The femoral vein is not seen. The motion, what appears to be movement of the artery closer to the transducer, is the amount of compression that was applied. This is a distal portion of the femoral vein. Here's the femoral vein, the femoral artery. After compression, no visualization of the vein, complete compressibility. Popliteal vein is now demonstrated. The uncompressed on the left side of this dual image. We can see the vein here. Now it appears to be anterior, but remember the sonographer is coming from a posterior approach. So the vein is going to appear anterior, but it is really posterior. After compression, the little slit where the vein was, normal artery, complete compression of the vein, no evidence of DVT. This is an image of the calf veins. They are difficult to discern on this image, but they are here. We can see some calf veins. After compression, those veins are difficult to appreciate, indicating complete compression, no evidence of DVT. A help in looking at these images is that if there was deep venous thrombosis in the calf veins, they would usually be enlarged and make them easier to see. There's this colored Doppler showing that the calf veins are patent. And now we'll look at the Doppler waveforms. This is the popliteal vein. We have nice respiratory phasicity. We can see just a hint of reverse flow. This is due to the elasticity of the vein. More phasicity, and now the augmentation maneuver has been performed, increasing the velocity of the venous flow. This is the femoral vein. We are looking at it here. It's the vein that is the deeper one on the screen. Nice respiratory motion. After augmentation, just a hint of reverse flow. This is due to the elasticity of the vein and not due to reflux. Normal Doppler signal. This is the common femoral vein, and We can see a maneuver here, and it appears that the sonographer has slid off the vein at this point. This back and forth indicates that they are straddling the wall of the artery, but there's a good augmentation maneuver here. This is the left common femoral vein and artery. We can see the uncompressed vein. Of course, it's medial. This is the right side. This is left. So on the left side, this is the medial portion. After compression, the vein disappears. This vein appears to be I have some echoes within it. This is a normal variation that we see. We call it smoke sign, and occasionally larger veins with slow flow will have some echoes within them. This is the femoral saphenal junction, proximal saphenal, great saphenous vein. Here we've got the common femoral vein, and they both compress nicely. Here's the artery. This demonstrates very clearly compressibility of the profunda and the femoral vein. We can see both veins here, and after compression, just the arteries are visualized. This is the left proximal portion of the femoral vein. Here's the vein. It's medial. After compression, here's the artery. We can see the artery, and the vein is not visible. This is the medial, or the middle portion of the femoral vein. Here's the vein. Here's the artery. After compression, only the artery can be seen. When we get distally, we can see the femoral vein, femoral artery. After compression, only the femoral artery is seen, indicating complete compressibility of this vein. Popliteal, again, it's going to be toward the top of the screen because of the posterior approach. Here's the vein. After compression, the vein is not seen, indicates complete compressibility, no evidence of DVT. Calf veins are seen here along with an artery. After compression, just the artery is seen. Color Doppler indicates flow in the perineal and posterior tibial veins on this image. This is the popliteal vein, a rather large scale for such small Doppler waveforms, but it still demonstrates phasicity, and the compression maneuver indicates increased flow with distal compression of the veins. Common femoral vein, nice respiratory, again, hint of reverse. That's okay, that's due to elasticity. And the compression maneuver, we have increased blood flow, indicating normal situation. Common femoral vein, this is all color Doppler bleeding due to muscle motion. The vein is actually here. We can see respiratory phasicity and a good compression. So this patient has no evidence of deep venous thrombosis.